Hello everyone, I'm Dr. Rohan Khandelwal, your Marrow General Surgery SS faculty, and it's my pleasure to introduce Dr. Preeti to all of you. She secured rank 1 in the breast and endocrine MCH section of the INI SS exam. Heartiest congratulations, Dr. Preeti. How does it feel?
Thanks. Feels great. I've been waiting for this result.
Has the feeling sunk in? I know it's your second attempt, so it's always after the theory you are concerned how the interview goes, when will the result come. So, how did it feel like yesterday when you saw this rank?
So, like, the result was a bit late, so I was getting very anxious when
Mhm.
it will come. So, interview part was like I was a bit anxious about that also because three seats against three seats they had called nine candidates, so the
Right,
chances were very slim. So, I was very anxious about it.
great. So you did your post graduations from AIMS Bhubaneswar in surgery, and then you took the INI exam. Why don't you tell us about your journey with Marrow? When did you subscribe to Marrow SS, and how did you prepare?
Sir, as soon as I finished my PG, I joined as non-acad SR here only, names Bhubaneswar. And at the
Hmm.
same time, in January or last December, I took the subscription and I started studying for that. Then in March, I thought I should drop and study properly. So for 1.5 months, I fully dedicated to the preparation. I resigned and I sat and I studied.
So you were very clear that you wanted to do breast and endocrine, or was it an open thing that you were even open for oncosurgery or some other branch?
No, sir, I was like very particular about this branch only. So I wanted to apply this. Even if I would have tried in NEET SS, I would have gone for breast endocrine only.
Any particular reason?
Sir, I think this is a lesser explored area and need is too much based upon the patients I have seen in my PG time. I think this area should be concentrated.
Absolutely, absolutely. Another advantage is there are hardly any emergencies, so that's another good part regarding this.
Yes.
So, right. So you were very focused, and I think so. It's always good if you're focused, then it's better to study for INA SS. Whereas if you have multiple choices, then it's better to go down the NEET SS route because then you get a choice of choosing the specialty based on your rank.
Yes.
So how did you go about it in the 6 to 8 months when you were preparing? How did you utilize the Marrow SS app?
So mostly when I was in hospital, then I used to do the question banks.
Hmm.
Whenever I used to get the time, I used to do the question bank. And when finally I sat down and I had time, then I concentrated on the videos and the theory, like Bailey and Sebastian and Swartz to some extent. I studied along with video and question bank. So combining all these three, I tried to do it.
Right. So the questions which we saw this time, majority could be answered from Bailey and Sebastian, and some bit, as you're saying, Schwartz again is an area from which you should do endocrine surgery. So that, along with the videos and the Q bank, helped you out. And
Yes.
what about the revision? When you were revising, how did you go about it?
So I had made notes of my own.
Hmm.
So in that, all whatever I wanted from the video, as well as few things which was left in books, I compiled it in my own notes and I revised my notes which I had prepared from videos and books.
Perfect. And in the exam, what proportion of questions come from breast and what proportion are, say, thyroid, parathyroid, and adrenal? So, is there an arbitrary division which you can share so that those who are preparing for the future can be benefited?
Sir, question like out of 80 questions, I think around 60 to 65 were from the breast endocrine area. Rest were
Hmm.
from general surgery. General surgery also they
Okay.
were mostly focused on trauma
Right. Right.
and a little bit the first basic principles of Bailey chapter. Then in breast endocrine part, majority questions I would say was from breast.
Hmm.
Then thyroid, parathyroid, adrenals were divided equally, almost
And
equally.
in the breast part also, a lot of students think that it's predominantly cancer, but did they ask questions from benign disorders as well? Because the chapter on Bailey has been authored by the AIMS team.
Yes, sir. No, sir, they are asking benign also because this is the main thing which we do. We focus on malignancy more and we
Hmm.
ignore the breast part,
Benign part.
the benign part and etiology part. So that should be covered equally. And
Correct.
reconstruction also to some extent. What this time, last time which I had given exam, they had asked the reconstruction part as well, plastic surgery part as well of breast. So that we should
And
attend.
how many questions were there from the statistics part? Because I remember last year there were a lot of questions from statistics, and that is why in the Marrow SS app we had added statistics modules also. So you have some questions from statistics this
No,
time?
sir. This time, not a single question was from
Hmm.
stats, and
Okay.
no question from recent trials also. I was expecting
Right.
that some question they'll give from trials and all, but not a single
Hmm.
question was there. So it is quite unpredictable whether they will give
Right.
stats and trials this next
But
time.
it's always better to be prepared. I mean, this year probably they did not ask, but that does not mean that they might not ask in future. So
Yes,
it's always it's better to be aware of those things as well.
yes, yes.
Perfect. Right. Now, once you got your theory result and you know you had been selected, then we had a session where we were discussing what kind of questions will they ask in the interview part. So how did the interview go? What all did they ask you in the interview?
Sir, in interview, they asked about mostly case-based scenarios. They gave parathyroid one case. Like first question, I remember that they asked patient is having renal calculi and proximal myopathy,
Mhm.
and then rest of the things which sir told. And how will you work up the patient?
Did they even ask you about your thesis topic and your residency?
Yes, sir. They asked about what cases I had seen in my residency and my SRship as well. Then they asked about thesis and other publications which I'm having or not.
Mhm. Perfect. So coming back to the app, you said that you solved the Q bank thoroughly. Were you satisfied with the standard of questions which were there in the Q bank and the explanations? And did they match the standard of the SS entrance exams?
Yes, sir. It was matching. Few questions like explanation was, I think that was technical problem. So otherwise it was okay, sir. The quality of the question as well as the explanation.
Hmm.
So I was okay with it. I was satisfied.
And did you take the mini tests and the mock tests which were held before the exam as well?
Not all. I could not take all, but
Hmm.
I think around 50% tests also I had taken, sir.
Okay. And did you even watch the general surgery videos other than the, like you said, trauma questions are being asked? So, in addition to the breast and endocrine part, did you get a chance to watch the general surgery videos also?
No, sir. Actually, I was focusing on breast endocrine because majority chunk will be asked from that. So I studied Bailey. I just studied
Hmm.
the basic principles part, and I think that
Right.
was enough to cover the questions.
Perfect. Along with the ATLS manual for trauma, because AIMS usually asks questions from trauma as well.
Yes, sir. Yes, sir. So Bailey basic principles I think is enough to cover that part.
So, finally, when would you advise somebody who's in their residency to start thinking about super specialty, and when should they start preparing? And what should they do in residency to ensure that they have a strong base before they start preparing for the exam?
Sir, actually, when I joined first year PG, I think within 6 7 months I was determined to take breast endocrine surgery.
Mm-hmm.
So since my PG days, I started scrubbing in such cases when thyroid, parathyroid, very rarely adrenal if it used to come. I started scrubbing in those cases and I started seeing those patients more in my OPD. So
Right.
I would say as early as possible, if you are you can find your interest branch of interest, then it is as soon as possible you can start working. So in first year only, I had decided that I will be doing that. So whole PG I dedicated especially to this branch,
Great.
along with
I think
others
so.
which are yes,
Yeah. Please carry on. You were saying something.
yes, yes.
So I think so having focus as soon as possible is always better. And if you have a focus towards one branch, then INI SS is the way to go. If you're still confused between multiple specialties, then it is better to go down the NEET SS route. Now we know what is happening with NEET SS with the unpredictability whether it's going to be held or not. So it's better to be focused and prepare for INI SS for the next session as well. And as Dr. Preeti shared in her journey, that even 6 months of good preparation along with QBank and reading some bit of the textbooks is good enough to crack the exam. So thank you, Dr. Preeti, for talking to us. Any final words or any words of motivation for the future aspirants?
Thank you, sir. Actually, I have seen your videos a lot. So the YouTube videos that also helped me. I always liked the way you taught. And what I will say is, whoever is planning to do SS, they should be prepared. That this is another residency. So you should be prepared for the next 3 months, like 3 years, like you have spent. And as soon as you find your branch of interest, that will be very good. Like, and rotation in our surgery posting always helps. So always they can, whoever is interested, they can find which branch they are more interested in. And I think as soon as you start studying, like consist, what I found is consistency is the key. It is not about how many hours you are putting, it is about how well you are revising it. And daily, at least you should fix a time. That consistent, from what I will say from my experience, that consistency is the key for getting anything you want.
Great, great. I think so. Those are very important words. And thank you very much for talking to us. Thank you, Dr. Preeti. Congratulations once again from the entire Marrow team. Thank you.
Thank you so much, sir.